Medication side effects, part 2. So today we're going to be discussing antipsychotics, and don't let the name scare you. It's a medication that actually can be used for folks who are suffering with schizophrenia and schizoaffective disorder, so folks who are having hallucinations or delusions at high doses. At moderate doses, it's frequently used for folks to balance out their mood when they have bipolar disorder, and at baby doses, it's frequently used for folks who need sort of a booster shot to their antidepressant medication that they're already taking. Maybe they've maxed out the dose and they've only been receiving partial mood benefit. And if that is the case, then sometimes a small dose of atypical antipsychotic can help alleviate mood symptoms otherwise. In terms of annoying side effects, most people complain of things like sedation, and frequently that can be alleviated if you take it at night, and sometimes it goes away on its own. For some folks, movement disorders play a part, and these are the dyskinesias. Folks can have lip smacking or pill rolling tremor, and those things can actually stay around permanently even if you discontinue the medications. However, they are not life-threatening. In terms of health-threatening difficulties, however, we are far more concerned with things like an elevation of your glucose levels, an elevation of your lipid levels. So it's really important to get a baseline lab panel to make sure that you're square before you even get started. But also, if you're consistently chronically taking these medications every 6 to 12 months, would be a really good idea. In terms of weight gain, each medication has a different profile. Some you can gain 2 to 3 pounds in a year. Some I've seen as much as 50 to 100 pounds, and that's really scary for folks. For some people, this can be mitigated by exercise, by a change in dietary habits in terms of reducing any sort of ultra processed foods or anything that's super high in carbs, just by reducing the carb and sugar intake. For some people, it requires a change in agent, or if we're getting a good response in terms of mood and psychosis and or mood stabilization, then that might mean that you take something else like a GLP-1 or a Topamax or a Contrave or something along those lines to help with the weight gain. In terms of the hairy, scary side effects, neuroleptic malignant syndrome is the biggest one. It's also known as NMS, but it's very rare. What's important for you to know are the risk factors for that. And if you are elderly, African American, male, multiple comorbidities or a lot of medical problems going on, if you are antipsychotic naive, if you're on a high dose antipsychotics, or if you're on multiple antipsychotics, all of these are risk factors that can play a part in you getting this hairy, scary phenomenon called NMS. And so the biggest thing to watch out for is if you have recently started an antipsychotic or have recently elevated the dose of an antipsychotic and you feel like you've run a marathon, you're exhausted, but you haven't really put forth any physical effort whatsoever. If your muscles feel sore, if you have any sort of muscular rigidity, and if you feel confused, if you feel like things aren't making sense, if you spike a fever, all of those things are really important to notice, and get yourself to an ER immediately. Do not pass go. Frequently, the treatment will be involving letting go of the agent and hydrating the holy crap out of your kidneys. So, in terms of any of these side effects, as always, please, 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 please speak with your doctor or prescriber.